Professor Glaser, what should I do if I suspect I have cancer?
So I think you're saying to me, I have noticed that I vomit after eating. I have noticed that I'm losing weight. I have noticed that I just am fatigued when I was active. I have found a lump on my back. I have found a swelling in my groin. I have found, if you were a lady, a lump in my breast. When I examined myself and had a bath, I found a lump in my breast. If you were a lady, you're telling me I have found that when I have my period, it's heavy. I am 60 years old and postmenopausal, and now I am bleeding again. You are saying that you have all these symptoms, that you can't pass your urine as you did, and you're standing in the loo for 20 minutes until the urine comes out. I think that's what you're saying, that you feel there's something wrong. Or it might not be a definite symptom. You didn't feel a lump. You are eating normally. All your bodily functions are normal, but you're not sleeping, you're lethargic. Any of these things that you think, this is cancer, or you're thinking to yourself, I've got the same as my friend at the Rotary Club or the Bridge Club. She or he had this, now I've got this. Or you're finding you've got blinding headaches. I think that's what you're saying. Now, what do you do? I'll deal with this in two ways. First of all, early diagnosis is absolutely and utterly essential. So it's almost an absolute commitment ethically that society screens healthy patients before they develop symptoms and they find the cancer at the earliest possible time. That's the ethical duty of the medical profession, of healthcare workers, and of course of government to provide screening processes for you. That means you have to take up the chance of that screening process when it is offered to you. A lady must go for mammography after 40 and x-rays of her breast and ultrasounds of her breast. A young girl must have a smear and an inoculation to prevent the cancer. So early diagnosis and prevention is your first moral and ethical consideration, both of you and of the society you live in. But once you have developed the symptom, you shouldn't be ashamed and worried that the doctor or the nurse practitioner or whoever you consult will tell you it might be cancer and I have to investigate it. So firstly, you've got to go and take advantage of any early diagnostic advice that's given to you. As a woman, the Well Woman Clinic. As a man, there are now Well Man clinics who do your tests for, say, prostatic cancer. So what I'm saying is you do the regular checkup for early diagnosis. Once you have the symptom, you go immediately. You don't worry that you will be told you have the cancer. You will go before you are told, and you will go with a mindset saying that if this, heaven forbid, turns out to be cancer, I am going to go through the treatment and the advice with optimism and clarity and faith. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.